The bonus we have in this hospital is we generally have more time with patients and you can actually listen to them. We're here to make sure the patients get a good journey, that they're not distressed, that they are happy. So having had that extra time, having had a nice experience is definitely valuable to them.
At Fernbrae Hospital, we want to give the patient as hassle-free a journey as possible. The prospect of coming into hospital will make patients very anxious, and we need to take that and help them along the way. We need to assist in every way we can just to make this journey the easiest possible way we can for the patient. So we'll take their referral, follow it up with their GP and make them an appointment that suits them and not the hospital. We want them to be able to pick and choose what consultant they want to see depending on the speciality required. We want to be able to give them as much choice of appointment time to fit in with their lifestyle and their needs.
Continuity of care, I think that's vitally important from the consultant's point of view. The decision-making process is echoed all the way down the line and everybody is singing from the same hymn sheet and telling the patient the same information. And from my personal perspective, it's important that the patient is able to access me if required. The patient has to be informed at all times of everything that's happening to them to allay any fears or concerns that they may have. It makes their journey throughout their experience at the hospital as smooth as possible.
Well, here in the imaging department we've got top of the range ultrasound machine, X-ray equipment, we do wrists, hands, feet, legs, fluoroscopy, which is like barium meals where you follow through the system. The turnaround of report is pretty instant. It makes the pathway for the patient very smooth, and we all kind of, because we're small, they get an instant report, they get seen to, and it makes the patient pathway all the quicker, all the better.
We treat a wide range from orthopaedic patients, we'll see them pre-assessment. We see sports injuries, work-related injuries. We'll assess them on their first session and from that we'll devise a treatment programme that's specific to them. So that can include manual therapy, could include acupuncture. We also have the complementary therapist on site and that can make a big difference to anybody who's had issues with anxiety and can actually make for a smoother rehab programme.
When patients come into us, we're aware that often it's their first visit, perhaps not just to a private hospital, but to any hospital, and that cleanliness is something that can be an issue. Infection control is the highest on our agenda, and we do make that everybody's responsibility, from the housekeeping staff up through the nursing staff, clinical staff, administration staff, right through to theatre and our consultants. At Fernbrae Hospital, we're very proud of our zero infection rates, and we've maintained that for many years, and we know that's a great comfort to the patients who are going to come and have their care with us.
The food is really high quality. The patient has got a lot of choice here, all freshly prepared, delivered on a daily basis, and the catering staff are very experienced at producing food for specialist diets. We have open visiting hours, and friends and relatives can visit the patient at any time of their choice. The patients all have single room accommodation with ensuite bathroom and shower facilities, and we have Wi-Fi in all of the patient rooms.
Well, here in Fernbrae we offer a whole range of surgical procedures. We do quite a lot of complex surgery, from orthopaedic. We do cosmetic surgery, bariatric surgery, colorectal surgery, which is done through the keyhole procedure. General surgery ranging from very minor hernia repairs, which also can be laparoscopic keyhole procedures. A lot of patients are very anxious before surgery, and that's natural. It's handing over 100% complete control. And that's often a difficult thing for patients, to hand over that complete trust. We go in this department by, if you treat everyone like they were your own family, then you can't go wrong, and that's the way we do it, and make sure that it all runs fine.
Quite often, you will get a thank you at the end because they've been through some tough times and we've been in with them every day. So it's nice to hear that you've actually made a difference, that you're not just doing a job and then walking away at the end of the day.